stimulating some ideas, we did have some prepared questions. So, we did go over some aspects of this, but these were some questions that we knew that were addressed throughout. So, again, what is free with the system? Everything Practice Fusion provides for you is free. If you integrate with the lab has their own cost, that's understood. But we will not provide you something that you have to pay for. That includes charting, practice management, chart sharing, support and training. Now, support and training are a huge part of that. Whenever you're looking in the HR, you want to ask them, how is support and training? Oftentimes, support and training are mandatory, and they cost money. So that's a whole other set of costs that they don't tell you about right after that. So again, if you threw something at me, is it free? The answer is going to be yes. I'm always happy to talk about the free model. It's a huge advantage of our company. It's what makes me excited, and a big part of what we're doing here at Practice Fusion. We could not provide these services to smaller practices if it was not for our free model. Our CEO, Ryan Howard, is focused on this. He's in line. Him and our Senior VP of Clinical Affairs, Glenn LaFell, he's actually one of our bloggers. They're going to be visiting David Blumenthal, the National Coordinator in DC in a bit, because they understand who is going to fill this role for small providers. Small practices, providers of one or two, who's going to provide this role? They need to have a free system. The technology is available to provide a free service. You've seen it in other industries. It's time that your industry started taking advantage of that technology. Add-ons through Practice Fusion. Now, this is also a huge part of health information technology, is third-party integration. I mentioned labs, billing solutions as well, and again, these are partners of ours. This is not, you're not stuck in the way Practice Fusion does things. If you find a billing solution you like, go ahead and maintain your relationship with them. If you want to look at others, talk to us about some of our billing partners. Lab integration, same thing. We want to create third-party integrations because if somebody is doing something right on their end, like they're doing a great job with billing, rather than trying to mimic that and provide you with too wide of services that would limit us in our main goals, we will integrate with them, provide you that service. This also includes chart sharing, labs, billing, e-prescribing, the patient portal. And then moving forward, we will be developing more API and sandbox features to allow individual developers to develop third-party programs for us.
What's an API sandbox?
It's
application provider interface, so somebody can make an add-on that'll benefit Practice Fusion, or if you use Twitter or Facebook, there are different applications that tie into them. Facebook uses a lot of games, for example. Those are done via an API.
Interesting.
if you can think about like some of the applications on smartphones. A lot of the apps for smartphones are third-party developers who have used the technology. Now, don't get me wrong, this is not an open source system, so it's not just open source, anyone can change your app. The reason why is because to be a certified EHR, to be a legitimate EHR, you need to keep that secure. But we do understand that there are so many specialties out there, there are so many various needs. We need to have people in the field who have the knowledge to develop it, give them the ability to develop stuff for your particular specialty. So this could include an interface with a particular machine that you use to gain that information, things like that. So this is something that is also part of HIT, Health Information Technology, and something that Practice Fusion is definitely moving towards. Now, as a full-featured practice management solution, absolutely. Now, using our third-party integration from the question above that, you can do your billing, you can do your document management, scheduling, all through Practice Fusion. Now, a lot of people start using Practice Fusion just for the charting, and they use another system for the scheduler, because they've already been doing that. That's absolutely workable with Practice Fusion, because it is modular. Same time though, we will of course encourage you to use the practice management features in Practice Fusion, because as you saw earlier, it's all directly connected. So when you see a visit, you can click on the link, it takes you to the chart, back and forth. So we provide you the practice management features because of the fact everything's integrated together, really just streamlines how you move back and forth between different pieces of information. This includes add-ons as well as features in the application itself. The question about insurance billing, again, this would be handled by a third-party integrated billing solution. We do have a fantastic billing product that is integrated into the system, allows you to do billing in-house. You know, anyone on your staff can send verification checks, send to clearinghouses, all of that. And because it's integrated, you merely just push a button from the chart itself, all the information transfers over, your in-house biller has the ability to do whatever they need with just a few clicks. We also have billing service partners who will do all that for you. And sometimes this is, you know, what small practices need to do, because maybe their office staff don't have the time to allocate to the follow-ups. So I suggest looking at the costs of billing in general, always looking at the bottom line, always looking at how much of my bills are getting received back. With our billing service partners, you have a team of billers who constantly are always just sending back follow-ups, scrubbing to improve, sending back follow-ups. So it allows you to, again, allocate resources to other areas. So, you know, you can definitely do that through Practice Fusion. And the, you know, advantages and restrictions for Practice Fusion at this point, you know, the possibilities and advantages, again, are allocating resources to different areas, not thinking about billing as much, eliminating the steps involved with billing. You know, sometimes we like to talk about, you know, how many clicks does it take to get to the end of a bill. With our integrated partners, we try to make that as few clicks as possible. Just bam, bam, done. You know, if you're doing billing right now with multiple systems, you're probably transferring information from one to another, following up. Perhaps there might be some clerical mistakes involved. The more integrated, the more streamlined it is to an electronic system, the better you are going to be able to obtain deposited bills. Restrictions would really just be the fact that, you know, if you're using a billing service, it's no longer in-house. If you're using an in-house billing service, you then have to do billing on your own. Make sure you have resources. So the way you would think about that is, what resources do I have in the office? Do I have a person who can really do the follow-ups? Or do I want that person doing something else and I want to outsource it to a service? So something to think about for your practice. Look at the bottom line always. Happy to talk to you about this. Put you in touch with the people so they can help you make a decision.
So I'm assuming that you could just create a thick fund printed out that you might have.
Absolutely, absolutely. Now the way that the super bills work is they are electronic, so you could even, for instance, just copy and paste something into another system, or you can print it out, you can send it to someone if they're in the same account. There's various options. We understand that, you know, billing is a huge part of running a practice. I mean, it's not what you want to be doing too much of, but you cannot get away from the fact that it's what you run your practice on.
Main building money coming
Exactly. If you're not doing billing properly, you're not going to be able to serve patients. So that's why we don't want to stick you into one particular way of doing things. We want to make sure that there's enough options that we can really talk about how your workflow works, how billing works for you, and what the various options are for that. So, you know, I mean, this is some of the information I had right now. I had some of these prepared questions. You know, before we leave here today, I would definitely like to give you guys access to the application. Just requires a minute. And again, the way it works is it's very much a learning process. Of course, I come from Practice Fusion. I believe in the application, but I understand also every practice is so different. It's going to be a decision on your part in the end. You really have to take a look at it, think about how it's going to work for yourself, think about how the support and training is going to be involved, what it's going to take to implement, make a decision on your own. The first step in that, of course, would be I would like to give you access. That way you can take a look at it, really see how it works. And again, if it's not what your practice needs, you just walk away from the account. There's no obligation. So I would like to give you guys all access to it today. I know my information's up there again, but I actually have some cards right here. You know, I'm in the office every day, you know, 5 days a week, and we have to talk. Yes?